All right. So the first question, and I think the first question of today, that'll be very important to know what is coronavirus and how this becoming and why this becoming a global emergency at the first place.
So it's a virus that originated in central China back in December. It's a new virus that, and again, I'm not a medical person, but apparently we have no vaccines or no way to actually treat. It's flu-like. Um, it's very virulent and has been spreading very rapidly. It was not noticed until almost a month later by the majority of professionals because the Chinese government suppressed it for a little while, and it's gotten out of hand. There's how many cases now in China, Karen?
Over 70,000.
Mm-hmm. They're starting to lock it off now, thankfully. But it's already, I mean, I think it's worth calling a pandemic. I know that World Health Organization is and other major organizations are not going to be willing to list things as such because it means they have to act in a certain way once they say something is what it is. But it's in multiple countries now and it's growing virulently in those other countries. South Korea had a huge explosion in the past few days of cases. They went from 40 to 500 now, something like that, in just a few days. And then Italy had a big blow, and so now officially titled COVID-19 or coronavirus, and it is a thing. And people, of course, anything with something like this that you really is completely out of your control, there is some panic that comes along with it.
Mm-hmm.
Is that a good summation?
It started in December, and now it's at the end of February. Okay. So anybody else have any feedback on this one? Do you think it's covered pretty well?
I mean, were we going to cover what it actually is, or before we go into the other concerns, or I can speak on that, I guess.
Yeah, I think she's asking general information, intro,
just general,
and anything that you'd like to add to the facts of the case.
Well, in general, I think that was covered pretty well. As with other possible pandemics in the past, that there are governments. It's not only China, but in this case it is, and it has been in the recent past. We've had some outbreaks as well where they suppressed it, and obviously that's a really bad thing. The coronavirus, there's actually different types of that virus, which is why this one's a newer strain and why your most recent flu shot is not going to be effective against it, because this is something new, and it's for a healthy person, in their adult years. You'll have some inconvenience there, but it'll be just like having a normal flu. However, for infants and toddlers and elderly and disabled who are, have immunodeficiencies, this can be death. Honestly, it's pretty nasty stuff. I know we're talking to laymen, so I don't need to go into grave detail, but it is something to be very concerned about. It's not something that we should just say, "Oh, it'll go away. It's okay. We don't need to lock down borders or anything." This could and already has, to a degree, got out of hand, as Karen said. And in China, it's bad.
That was a good thing you brought up, though. I didn't think to mention that, though, as comparison to things like SARS or other outbreaks, things that we've seen a little bit differently. SARS infected at a much slower rate. The big thing we were seeing difference here is that SARS didn't infect until after you had symptoms, whereas this one is apparently you can infect before showing any signs of symptoms. which has made it considerably harder to track. It's already killed more people than SARS, even though it's been around for a shorter period. SARS was about a year and a half cycle that we dealt with that, somewhere in there. And this one we're right at 3 months now, so considerably more of an issue in spreading. But yeah.
I
think the other. Go ahead.
Oh, I was just going to say this is actually a lot easier to catch and begin symptoms than SARS and the multiple other ones that came out of the Asia territories.
Mm-hmm.
Yeah, and you're absolutely right that you're contagious before, and that's the thing with like a normal flu or a cold. You normally start feeling ill about the same time or a little bit before you're actually contagious. And this one is not that way. It's very stealthy, like a rogue or a ninja or something. Not to bring the Asian thing in there. That sounded horrible. I shouldn't have used ninja, but someone's going to say something about it, I'm sure, in the comments. But it's very sneaky, and so you know, there is reason a lot of people make fun of the people wearing face masks and washing their hands like they've got OCD. And no, you need to be doing that, especially if you're in an area where you know that it's active. And it is very active in many continents right now.
Mm-hmm.
Countries.
Yeah, very true.
Countries, not continents. Sorry.
About it. And okay, so we live in different states, and we have different groups, and even some states have cases and some not, and some people would have family members or friends with outside another continents and will have experience. So what is your observation and experience so far with this coronavirus crisis?
Well, being in Southern California, where we have a lot of use of mass transit and a lot of busy areas, I have, oddly enough, there are certain folks who seem to not have any concern at all, and then there's certain groups of people who are very protective. I like even going to an extent of wearing gloves and whatnot. But I have seen a lot more of that, things that, as I was saying about the face masks and stuff, that was kind of something that people would kind of razz each other about or whatever just a couple of months ago. And now those same people are, you know, wearing the masks and carrying around the Purell hand sanitizer and all that stuff and practically slathering their entire body with this stuff, which that brings on other problems that we will have to talk about some other time. But I have noticed, especially in the bus systems and the trains and the metro and all that, that people are taking precautions, that the city and even out in the county areas have began hanging up like sanitation stations and whatnot on the walls. A lot of doctors' offices. I just went to the doctor the other day, and they, before you even go into the building, they've got a station set up there that if you've got a cough, if you've got a fever, if you're even feeling tired, put this mask on before you come in, and don't, you know, be aware of what your hands are doing. Don't, you know, grab the doorknob and then, you know, itch your nose or your eyes or stick your finger in your ear or anything like that, because it's just that easy to catch it. And I mean, I would say that I am kind of happy to see that the cities and the counties are being proactive about it instead of reactive. So I am happy to see that, but that's how Southern California is right now. I wouldn't say that there's a panic going on yet, although there certainly are some folks who are saying this is going to turn into a zombie apocalypse. But it's Southern California. You guys all know how we are down here, right? We're crazy. We get too much sun.
Just in general, from locally and from foreign, I guess is on two fronts for us. Locally, where we live in Mississippi, it's life is normal pretty much. I don't think really anything much has changed around here. I think for most people around here, it seems a little bit too distant. And also, to be fair, with what's going on in the States, we haven't had a significant outbreak of any kind of it, at least yet. Our area tends to be a little more rural, and not just necessarily in there being farms and stuff. We live closer to one of the bigger cities, but I think it's just not as a number one stop for most people in the States. So there's a little bit less feel that somebody's going to come traveling versus some of the other areas, San Francisco, LA, New York, where you're going to have a lot more traffic of people. So in general, I think people are concerned about it, but it's not in any way like bothering people per se around here. On the flip side, well, I guess you know what, Karen, I'll let you talk about the other side of the ocean for us and what's going on with them. So, and then Hawkeye can.
I think my parents lives in China, so I talk with them almost every week and just get to know what their situations are. And they told me about it. It was pretty severe back there, and whenever you have to go out and go back to your neighborhood, you have to show your ID to make sure you are the person that you say you are. You cannot get into the neighborhood without your ID card, without testifying who you are and truly live there. That's no visitors will be allowed, and everybody wear mask in a public setting. No matter you go on a bus or you walk on the street, people don't usually get into close distance anymore. If you see people walking towards you, and they would on purposely, intentionally have a physical distance towards you, so nobody would actually catch anything like physically for sake. And there's no people on the street, and nobody really go to work or go to school at this moment. And some of them are staying at home for schooling, like online lessons, and some are working at home for their companies. So they're pretty severe right now. It's everything. Everybody's very cautious. Hmm. And they worry as well. They're pretty anxious about it. A lot of people. They want the whole situations get better, but at the same time they know it's a severe situation to be in right now in China.
Yeah, just in speaking about the differences, I did want to remind people that I am in the Los Angeles area, and so that's why we're reacting a little bit more there, because there is we've got ALAX. Everybody knows that. Pretty much anyone that comes over from Asia, especially China and Japan and Korea, land just a couple of miles away from me. So, and then I spend a lot of time in San Francisco as well, because my daughter's hospital is all the way up there. That's where the specialists for her spina bifida are. And so, of course, we actually have a large population of Chinese people up there who have families that come in and out. So I'm getting hit on two fronts. But that's why the reaction might sound a lot. I'm fading out on the word I wanted to use, but my reaction is going to sound totally different from theirs. because of the fact that we do have people directly flying in from there, and they were like he was just saying, it went for a good month before anyone even said anything. So we had people flying in here that had the virus. So
there are a lot more of like the hand sanitizer stations around, like before you go in places, in stores like shopping malls and things like that. It's a little difficult to tell because that's kind of been on the upswing here for a while now. So it's a little difficult to tell if that's directly related to this or if it's just that's something that they're just kind of doing more of here. I think some of it probably is related. We hear about it a lot on the news. But other than that, I don't think much has really changed. It could be a little bit different, I suppose, as I'm thinking about it. Our family takes care of my grandmother, who is 100 years old, and so we are always extra germophobic, more than we would be otherwise. So our family just takes a lot more precautions. So it could be that for the average person living here, yes, there's more precautions being taken, but not particularly that I've noticed, other than, like I said, the sanitizer stations and stuff.
Well, my next question for you guys is that what problems you have recognized right now so far on others or even on yourself in the process of dealing with this crisis at this moment?
I think the biggest problem is not really the crisis itself, but maybe how some people are reacting. And this may be bleeding into another question later on, but it's the one thing that's kind of annoyed me with this whole process, is some of the, I don't know if I can call it racism, because of this is also happening in China that we know of, but just a lot of people acting stupidly towards Chinese a little bit. We've seen it a couple of times. Oddly enough, we've seen it mostly by other Chinese, which has kind of thrown me off kind of a good bit. So we have some people we know, for instance, and we have a Chinese restaurant here in town, and these people are also Chinese, and they don't want to go to the Chinese restaurant in town until this issue is over. Which, of course, the odds of anyone in that restaurant having been to China, even somewhat recently, are not the strongest. And this is in the middle of Mississippi. It's like it's completely out of the way. It just doesn't make a whole lot of sense. We don't have anything anywhere near us. There's the one case in Texas, and that's the closest that we've had, and that's pretty far away from us for the most part. So it's just weird having some of those reactions from people not wanting to be around other Chinese. It's kind of like the whole idea of when there was a lot of the terrorism going on, or when ISIS was big and people were scared to be around any kind of Muslims around. It's like just because they wear a hijab that they must be associated with that. I don't know. It's kind of that same mentality. It doesn't make a lot of sense. And then we have some people in China as well that have told us that there's been issues with, we know a number of people in China, obviously, but with people coming from the Hubei province or even anywhere around where this is good. Not Hubei, I'm sorry. What's the province? Wuhan's province.
Hubei.
Oh, it is Hubei. Okay, for some reason I was thinking, never mind. Okay. But yeah, you go into other parts of the area that people have been asking them to like not be around them, or there's been a lot of like neighborhoods closing off their borders, not letting anyone around in a very negative way, not like a good way. What was the flight, Karen, that happened?
The flies
Yes.
in Japan?
Was it the flight in Japan where the people wouldn't get on the flight because the people were from China?
Uh-huh.
You want to tell us about that real quick, since that's kind of I can't remember the details of that.
Well, just briefly speaking, there's a flight in Japan that the Shanghai passengers would not aboard the plane because Wuhan passengers are there. So they asked to be isolated from the Wuhan passengers and asked the company to send the Wuhan passenger home first and then arrange a separate plane to send them to Shanghai. So that's just the incident.
This is from Japan, so obviously these people are not in Wuhan to be picking the virus to begin with. So that's kind of the interesting. Anyway, it's like I said, it's mainly been Chinese on Chinese for the most part that I've seen, which has been the surprising part of it.
And fear.
Fear.
Because anxiety and worries and not knowing what's gonna happen, so that stirred up the negative emotions and feelings and stuff like that, especially fear, anxiety.
Just going along with that a little bit. I mean, and then this is sort of a general observation for other cases that we've had, other sicknesses that have gone around, but especially here in the U.S., I feel like there's kind of a tendency by the media to sensationalize. And I think it's important that we have information. It's important that we know the facts. But the sensationalizing, I think, really contributes to some of these behaviors. Because in some ways, I feel like they're not, and even, I've seen this on the news here. It's like, well, are you guys just trying to, create more fear because you're not sharing any new information right now? You're just, trying to scare people, or, that would be, I guess, one of the main problems that I'm seeing from my perspective.
I think there is a problem with the media. They've done the same thing with Chinatown, the Chinatown area just south of Glendale in Los Angeles. There is a big area there of Chinese, and when I watched the news in the evening, they made it sound like it was on lockdown, and nobody was allowed in or out of that area. And man, they made it sound way worse than what it was, because it's not on lockdown. And most of those people in there are American citizens. They're Chinese as far as ancestry, but they haven't been to China in the last. Some of them haven't been there in a decade. And I've got a couple of friends who work down there that own restaurants and whatnot. And, they're like, dude, don't watch the news. That's it. They're like blowing this way out of proportion. And the bad thing is we're already on edge in North America with, as far as race relations, if you want to call it that, whatnot. And then to throw that in there, it's like everybody else is going to see the news and they're going to react even greater than what the news is reported. And the news is trying to make it out like, hey, these people have something that's going to kill your children. And there's going to end up being people that are going to go down there and maybe possibly cause harm. And man, I wish, again, probably another topic for another day, but the media needs to stop with all of that.
Lately we've started watching Japanese news because it's actually news for that reason.
Well, even like I watch the news from Scotland and well, there's one station I watch from Dublin, and they just give the facts.
Yeah.
There's no like. I mean, everybody has a bias. I mean, even I do with certain topics, but I just want the facts. I don't want you trying to persuade me to go on one side or the other, and especially when there's things like this that could potentially be harmful. I mean, people, some of those people are very susceptible to being pushed into a violent end. And I would hate to see, something where people started going down there and burning buildings or something. And I mean, I know some people are, oh, that wouldn't happen. That wouldn't happen. Let me remind you of the Los Angeles fires when Rodney King trial was going on. It absolutely could happen. So, yeah. When you were saying that, and then Hawkeye was saying what she said, because before I was like, oh no, it's probably not that bad. But now that I'm thinking about it, yeah, it's bad.
It definitely can. And I agree with you. You come in earlier on the whole idea of being proactive instead of reactive. And we need to be proactively thinking about how our actions are going to be affecting people. I definitely agree. There's no accountability for media in America, which is not a good thing. Head back to the days of yellow journalism.
Yeah.
You remember your history on that one, but yeah.
If I understand you guys correctly, which just means that we have to be responsible for what we see and what we say and what we watch and what we read online and social medias and even news, and we will have no control with what the media say, but we can control what information we receive and what information we share with others, and have discernment of which is true news and which is fake, and what is the truth and what is the rumor.
Absolutely.
We talk about the problem we have seen, we have recognized so far. So as a viewer ourselves, as an individual in this society, as a Christian ourselves, are there any healthier ways to look at these situations and have a more positive perspective? And are there any attitude that we can take, and any lens of wheels we can take, any perspective we can take, and be more positive and healthier?
I think so. Anytime that I've ever done, of course, most of my mission, most of my mission trips have been to Mexico and Central and South America. So I haven't gone anywhere. I'll use the bunny ears here, exotic. But we've always made sure that we did see if there was any kind of flu virus or anything that was being experienced in that country before we headed down. We were prepared with supplies and medications and whatnot, not just for ourselves, but for the people that we were going to be helping out when we got there. We made sure we were up to date on our shots, immunizations and whatnot, which unfortunately, as we said earlier, that's not going to help you in this circumstance. But there are ways to, if you're going over that country for family or friends or honeymoon or a mission trip, you need to just be, do the Boy Scout motto. You don't have to be a Boy Scout to do it. Always be prepared, and know what the environment that you're going into, and don't treat these people, the sick is who I'm referring to. First of all, don't treat everyone like they've got the virus. Now you do need to be respectful, and as Karen was saying, they have a rule that you stay so far away from people right now. I think that's a good rule to follow myself, especially being a person with OCD. I don't like touching people anyway. other than my kids and my dog. That's cool. But you just want to make sure that you wash your hands lots, that you cover your mouth when you sneeze and cough, and you be respectful of people's space, and don't treat them like they're zombies or something. They're real living people that are they're sick, and they need respect and love just like everyone else. So those would be my little 5 cents of wisdom, I guess.
Yeah, and I would agree with that, and say so as well on the home front too. Just as a reminder, I think no matter what your beliefs are, I think most people can agree with the golden rule: treat others the way you want to be treated. Mm-hmm. Yes, you have to do certain things, you have to take certain precautions, but you can take precautions and be a jerk, or you can take precautions and be very kind and humble with the people that you're dealing with at the same time. If anybody here that's listening is, for instance, has a family member that serves in the military, or has had someone who has served overseas, think about what those families are going through. And that a lot of the people here are going to that same issue in America or anywhere else if somebody may be living that has family in China like we do. Mm-hmm. My parents-in-law are living in an area where they're older, and they're living in a neighborhood where there's confirmed coronavirus going on. Mm. And we can't go there, and we can't do anything for them. It's an enemy we can't fight, and we just pray for them. But to be considerate with the other families that are probably going through the same thing here, they're concerned about their family, and they can't do anything for them. They just have to pray for them and hope for them. So just to be very considerate about who you're talking to. Don't say stupid stuff. Put yourself in their shoes.
Agreed.
Yeah, basically, the car took exactly what I was going to say. But yeah, great minds, I guess. I think, being prepared, there's a certain amount of just prudence in that. There is, the element of, you do what you can do, and trust the Lord. I mean, really, if we think about it, there are so many things that could be deadly to us every day. Not just this. I mean, I think if we live by a very prominent university, they had 2 young students, one of them on the football team, very active. 2 students fall down dead with a heart attack this week, out of nowhere.
Wow.
Honestly, that could happen to any of us. We could walk out in the street and get hit. So, yes, there is this added threat, if you want to call it that. But we live in a world where nothing is certain. And as believers, we know that our future is secure. It reminds me of, we had a wonderful lady who used to help with my grand's care. And my grand she was going through an illness, and she said, "I'm afraid I won't wake up." And this lady, she's from the Caribbean, and she would hold my grand's hand, and she would say, "It's okay. You'll either wake up at home here, or you'll wake up at home there. Either way, you'll be at home." And that's true for all of us. And I think it's with that knowledge, we can bring a lot of comfort, I think, to people who really are panicking and frightened.
Yeah, I agree very much. We as Christians can definitely have an impact on others, because I think that's the silver lining to a thing like this, and where God turns all things for good. No, nobody wants this. God didn't intend for death to be a part of life, but being able to share that with something like this, that it's this enemy you can't control. It's not like a military power invading your country. there's just this complete hopelessness that people have with this that don't know Christ. And I think that's a wonderful time for us to be, especially as Christians, to be loving and caring and showing that light, because what's the saying you always say, Karen? When we get to the end of ourselves is where we find God. People are at the end of themselves right now. Like, there's nothing they can do about it. So they can't pick up a gun and shoot at it. Not that that would help anyways, even with real people, but yeah.
Yeah, I agree with all that. I think I've said it on every podcast we've done that I worked for almost a couple decades as a EMT paramedic, and I was definitely awakened to the frailties and the strengths of the human body, and to the reality of that. Honestly, it drove me even closer to understanding how things work, that God's in control, because I witnessed people who were in terrible, terrible accidents or had a terrible illness that they should have by all rights died that day on my ambulance or before I even arrived there. And they lived and are still alive today. And I witnessed other people who I transported to the hospital, and I thought, oh, they're going to be fine, and they didn't make it. I've seen it go both ways, and it's just when it's your time, it's your time. And I myself was told I only had 2 years to live, and that was almost 10 years ago now. So, when God's got something for you, he's going to keep you here, and when it's time to call you home, he'll call you home. And there's peace in knowing that whether, like Hawkeye said, whether you wake up in your own bed or you wake up in the arms of Jesus, that you're there, you're at home, and you can have peace in that. And that does. I can't remember which podcast it was where we were talking about it, but it's a perspective thing that I think a lot of us Christians, especially in North America, at least from what I've seen, maybe I hope I'm not being racist against my own people in America, but I feel like we kind of get in this, not lethargy, but kind of we get too content in the peace and security and the freedoms that we have in this country, and we forget how the rest of the world is, the condition that they're in. And it's real easy for us to not be concerned about the rest of the world. There's people, I was just watching, it came up on my algorithm, we were talking about that earlier on YouTube. I don't even know why that came up either. It's another one of those YouTube things, who knows. But there was a person in the Middle East who was sitting there in a room hiding behind his couch with his daughter while bombs were going off outside of their home and mortar shells. Yeah, and he was teaching her to sing. Every time that she heard an explosion, she would start singing a song. And it immediately, because just minutes before that, I was just watching YouTube videos on World of Warcraft and not even thinking about the rest of the world right now. And then, to see that and go, wow, right now that's going on. Right now, somewhere in the world, someone's grandmother is sick with this coronavirus, and they don't know if she's going to make it through the day. Somewhere in the world, there's someone that is being cut off from water and food by their own government. And, you start, I'm not saying that you should dwell on those things and become utterly depressed and not do anything about it. We absolutely should do whatever we can for the rest of the world, but we do need to keep that in perspective, and that, when there's anyone suffering, I feel like we absolutely should try to reach out and help as much as we can. And I know that some of the people that watch our podcast are really young and maybe even still in high school, or whatever, and they feel like there's nothing I can do. But um, we've got the internet. We have a lot of power to be able to reach out to people and help out with organizations. You don't have to do it financially, Uh, but well, I could go on and on, but I'll cut it there. Just kind of wanted to do that thing again, where it's we need to have the proper perspective, and it does help you to have that compassion in your heart to help those people and understand how fortunate you are, especially if you do live in North America, including Canada. You get all connects up there. We all have it pretty good. We have it really good. And there's a lot of people very close to us who aren't having as good a time. So at the very least, even if you're a high school student or you're a junior high student and you're like, Jazeel, there's nothing, I can't do anything. I don't have a job. I can't send money, and I'm not old enough to go on a mission trip, or I can't go over there and provide aid, or, join the Job Corps or whatever. It's like, okay, but you can pray for them, right? At the very least, let's do that. Let's pray for them and see God work. And if you get the opportunity to, be around, well, this works for anybody from any culture from all around the world. Many of us are mixed anyway. Be kind to them. And, I understand the fear that the media has put in your hearts. We talked about that too. Sometimes you got to shut that TV off, or turn the channel. If there's a Chinese restaurant, or you have a Chinese neighbor, or you should do this for everybody, not just Chinese people. But you need to treat them with respect and with love and with dignity, and stop allowing the media to turn us against each other. Because I don't know if they're doing it on purpose. I don't know. I'm not that smart with media relations, but it sure seems like it. Because like I was saying about Chinatown down here in LA, they were making it sound like, oh, stay away from them, they've got the plague. No, dude. First of all, yes, you can get sick. Yeah, it's a reality, but it's not that bad. And you shouldn't be, as Karen was saying about when 9/11 happened. Most of us remember that. That anybody that had a turban on, or dressed differently than us, all of a sudden, if you're from the Middle East, you're a terrorist. It didn't matter. The people were going and throwing bricks through 7-Eleven windows, and going into Middle Eastern people's neighborhoods, and spray painting on their cars, terrorists on their cars and stuff like that. And we need to stop all that. Unless someone gives you reason, and I don't see any reason to vandalize someone's property. First of all, if they're doing something wrong, then there's a legal way to take care of that. But for this instance here, you need to pray for these people at the very least. And if you can help more, then awesome. But I'll stop there because I can keep going for another hour. Sorry.
Okay, so we can pray for those people, and we can adjust our attitudes into trusting the Lord and caring about the world, and we can choose to not have bias and discriminations upon those people suffering, and we can choose to not blame each other. Instead, we unite and cooperate with each other for the greater good, and we can be aware of our health and personal hygiene and make sure we wash our hands often, every day, especially for people who have a lot of social interaction with others, as your career or school needs, whatever it is. So I need to wash my hand often as well because I see a lot of people every day. So anything else as a Christian, as a person, individual, what else you can think of that could be helpful to deal with this situation in a healthy way?
I mean, one thing I did a number of weeks ago during Chinese New Year was I work at a school, and so I got permission to decorate. My office is in a lobby entrance area, and I decorated the entire lobby for Chinese New Year. And we put up signs and everything, all the traditional stuff that you would typically have. And I got red envelopes with coins in them, and put in there telling people what the coin was a lucky coin, kind of like a feng shui lucky coin, and just saying during this time of the year, Chinese are all looking for prosperity and hope is the general idea of the new year, so that we pray that they might find that hope in Jesus. And that was pretty much it. Like, it really wasn't. It was what, $15 worth of decorations. I put them up, maybe $10 for the red envelopes and coins, and just did that. And so obviously that took a little thought and effort, but the point being, it helped to raise awareness. It got a lot of people thinking and talking on campus that otherwise would not be thinking about it. So I think that is one thing we can do, is something like that, like going off of what David said, that we as Americans can be very ethnocentric. We can forget about what's going on the other side of the world. So I think helping people empathize, making it real to people, is a great thing to do in a very kind, caring way. Things like that.
I don't know that we've necessarily been more cautious because of this specifically. We just are all the time because my grandma's immunocompromised. But, I think it goes back to taking precautions that can be taken, but understanding that life itself is in the Lord's hands. And we could do everything right or everything wrong. And it's not, it's, the Psalms talks about our days are written in his book before one of them came to be. So I think that that's helpful to keep in perspective. I think obviously just talking about it as a family, I think keeping things close while there is a point for that, there's also, it can become kind of a thing, like in Harry Potter, I'm just, because that's where I think, he who shall not be named. It gave him a lot of power just because, you couldn't even say the name. It's like, well, no, it's not something that we have to avoid. It is something to be aware of. And I think, finally, probably being educated without being hysterical. Even we talked about this a little bit earlier too. People are like practically bathing in hand sanitizing, and that's not helpful either. But I think knowing what you can do and doing that and doing it faithfully, because that's good stewardship, is important. And then recognizing when, yes, we've done everything that's humanly.
Yeah, definitely. Well, thank you very much. And it sounds like we basically cover a lot of the things we talked about, what the situation is and what's the problem we have observed and experienced, and how we can deal with it in a healthy way, a more positive way, and how to be a salt and light in this world and a darkness at the moment. How to be helpful for others, no matter they're overseas or local. So at this moment, it's very, very important to keep ourselves physically, mentally, and spiritually positive, healthy when dealing with this.
The biggest thing is just please continue to pray. That's a huge one. That's the best thing we can do.
We want to pray for the people and who are suffering from this global crisis, no matter they are in China or not. And I know that it impacted a lot of people in different continents. So, Heavenly Father, then I'm grateful that we can gather together in front of you. We're from different races and ethical backgrounds and even live in different areas in this globe. Lord, we are thankful that we are still breathing and living in front of you, even though sometimes we have sickness in our body. Lord, we lift up everybody who is in this coronavirus at this moment, all around the world in you, Lord, including China, Japan, Korea, all the areas in South Asia, and even the areas in the United States and Canada and a lot of countries in Europe. Lord, I know a lot of people are very cautious and very anxious about it. And Lord, we pray for peace and for those people. We pray for comfort for those people that be able to look up to you and find peace and find comfort and find hope. And knowing that the only control is from you and not from us and not from anybody else or even governments. I pray for the wisdom from the doctors and nurses and everybody who works in the lab and trying to work out the vaccines or the cure. Lord, I pray that Lord, you give the wisdom through them and help them to figure it out, help to best help the patients and care for them at that moment and provide everything they need, no matter it's materials, medications, and labor. Lord, I pray that you give them wisdom. And I also pray for rest. For all those who work in the front line, they are nurses and doctors and everybody who's delivering supplies and working, making masks, and everybody that trying to provide the best as they can. And I know they're tired and exhausted, physically, emotionally, even spiritually. I pray for rest for those people, be able to regain strength after the rest, and also be able to feel encouraged from their families, from friends, from communities, and from the government, the country, and from all people of the globe. And knowing that they are contributing to humanity in a major, major way, that we shall not forget them or make them feel any underappreciated. Lord, I pray for everybody who has not been affected so far, but wondering how they could be helpful. And I pray that you open their eyes to see what they can do, even in the minimum and smallest way. Even just say a prayer in front of you. Lord, I'm grateful that all of us have life and will be able to breathe in front of you right now. But I pray that you will give us the eyes that you see, the hearts that you breathe, and that help us to worry about the things that you care about, to pray about the things that you want us to care for, Lord. I pray for that every day you put that in our hearts. Um, and I pray that you listen to the prayers below, that no matter they say it out loud or not. And I'm thankful for you today we gathered. In Jesus' name I pray.
Amen.
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 Amen.